Do you think that in any way got her to say, gee, I'm not sure we can do this? I guess I would say Tiffany does not know the word give up. Never give up is her mantra. She can do anything. She's extraordinary, gifted, and talented, and you might as well just go ahead and do whatever she says, because if you don't, she's just going to continue to give you all the support and all the help you need to help you be successful and stay healthy.
And that is true. I don't give up. When it comes down to health, I don't give up, because I know what it's like to feel like people have thrown in the towel on you. I know what it's like to feel like you're by yourself. And that's an awful feeling. It's an awful feeling to feel like you failed in life. You know, and that's what a lot of people who are obese feel like. You know, they feel like they've let themselves down, that you're out of control, that you're all of these things. Well, you know what? In the next second, you can take control. In the next second, you can begin to live your life the way you want to live it. And if you don't know how to do that, I will help you do that. We will help you do that. Texas Kidney Foundation is waiting to help you do that, because no one is alone. We are Texans. And when we say that we're in this together, that's exactly what we mean. We're in this together. We will help you in whatever way we can. The only thing that we can't do is call you up and we don't have your phone number. So you got to call us. You got to contact us. But we can tell you everything from there, give you all of the steps that you need to get to the next level. And that's for anybody. It's a free service. And it is, we created it because of the need in regards to kidney disease and how it relates to diabetes. Diabetes is a major problem here in our state and in our nation. I would say diabetes could be considered a pandemic of its own, along with kidney disease. We've got these chronic illnesses that are so pervasive, and people don't know enough about them. They don't know that they even have them. So, it's easy to feel overwhelmed when a doctor or a nurse or a medical professional tells you that you have a chronic illness. But know that the professionals that we have at Texas Kidney Foundation and the wonderful doctors that we have the pleasure of working with, and nurses that we have the pleasure of working with, they're all there to help you. They all have a heart for our community. And I that was one of the things that I really liked about you, Dr. Gibney, is the heart that you have for patients and for engaging the patient in the process, because that's so important.
Yeah, if you want to talk about the next section, you want to talk about being lonely and spirituality, because obviously a lot of people are struggling with being lonely and spirituality, because why? They're locked down. They're people in nursing homes that have no contact from anybody. What do you do for them? People that are locked down, or they're trapped in their apartments and nobody to talk to. It appears like nobody cares about me. Mm-hmm. Those are huge issues of depression, alcoholism, and all sorts of.
The alcohol rates, the liquor stores were literally selling out at the beginning of this pandemic, and it's been one of the most lucrative businesses. The liquor stores have been one of the most lucrative businesses.
I know.
Throughout this pandemic, which is just
a essential business, liquor stores.
I know. I'm like, I don't know if that really counts as essential. I don't think that should be on the list, but we're not gonna quibble about what's on the list. I support our government. If somebody thinks that's essential.
The rationale was that there are so many alcoholics already. If you close the liquor stores, it'd be even worse.
Oh my God! I hope not. I hope that wasn't the rationale. But it definitely speaks to the fact that when people are locked down like this, when people are quarantined, that there's a lot of isolation that goes along with that, because I don't think that anyone realized, A, that it would last this long, and B, that how much interaction they had at work and in other areas of their lives, just going and being out and about. I have small children, so I still have the same level of interaction as I normally would with other human beings. I have two small children, a 10-year-old and an 8-year-old, and then my husband. And I'm still, because we are essential, we're still going in and out of our office. Our office is just not open to the public in the sense that people are in the office, but we do our screening as a drive-up screening. So in order to maintain safety for the patient that's coming to Texas Kidney Foundation, but we are still functioning and working every day. So I'm not experiencing the same thing that our other counterparts in Texas are experiencing, which is varying stages of isolation, depending on whether or not they have the person has an underlying condition, and that can be hard. What are your colleagues saying?
I'm sorry?
What are you experiencing when you're dealing with people and the isolation?
It's the same. Yeah, it's the same thing. I mean, it's rough. I'm becoming pretty good at video conferencing, and so
exactly.
And you get used to what we call it, the kinetics of video conferencing. So, so I think that's another benefit. Telehealth is another benefit. They're good. There are significant good things where we can come out of this, and we will be better. And the whole concept of good customer service for the person, the patient, the person is going to be dramatically better. As you know, medicine was never focused on customer service, but now coming out of this, we're going to realize that, we're going to try to figure out how we can transition to much stuff as at home. So instead of the person or patient having to go everywhere to get x-rays and lab and doctors and all this stuff, how about you come to the person at home and make it where the knowledge and the therapies that the person needs can all be done at home, and you take the tremendous amount. And who benefits the most from this? People that are vulnerable, marginalized, the poor. They don't have to say, "Well, I don't have a car." Well, I don't know how to ride a bus.
And the cost is significantly less. The cost is significantly less when you're using a telehealth model. Like for our cost per patient has gone down significantly. All of our services that we offer through Texas Kidney Foundation is free, but we have been able to get a number of tests for free from other agencies and through the government that all we needed was the doctor or the nurse to conduct the test. So now our costs per patient, like for lab work, for some of the lab work that we're doing is under $20, which is, if that same patient went into a doctor's office, they would pay in the range of $100 for the same test. And yet they can get the lab work at the lab, eliminating the middleman. Texas Kidney Foundation just utilizing one of our employees, or multiple employees actually. But and the cost went down to under $20.
So the magic of this story that you're sharing is that we can improve the quality of medical care.
Mm-hmm.
We can improve the outcomes of medical care,
Exactly.
and at the same time decrease cost.
Exactly. Very cost efficient. Mm-hmm.
And most importantly, improve the patient experience.
Improve their experience, and that's what empowers patients when the experience is a good one, and they get the outcome that they need. And they're not breaking the bank to do it, because you don't want people in a position where they're having to choose between whether they're going to eat or how they're going to feed their children, and that is a real choice, or whether or not they can afford a medication that they need, as opposed to taking the test. You want them to take the test. You want them to be able to afford that piece of healthcare that they need, that little piece of their healthcare puzzle that they need. You're listening to On the Record with Tiffany, and I'm talking with my special guest, Dr. Richard Gibney. Come back and listen a little bit more while we talk about chronic kidney disease and the changes in healthcare that COVID-19 has brought about that have actually been good for us and that are going to help us as we look to the future.